back there while I introduce Dr. Meier. Sorry we don't have hers on here yet. We'll get that in a second. Dr. Grace Meier is a family medicine physician. She joined the Clinic for Special Children in Pennsylvania in August of 2020. Her training in family practice allows her to see patients of any age at the clinic. And, as some of you may know, one issue with metabolic diseases is that even adults continue to be seen at pediatric clinics. So this is something really special that the clinic has done over there. She earned her bachelor's degree in biology from Bryn Mawr and her medical degree from Sidney Kimmel Medical College at Thomas Jefferson University. And she completed her family practice residency at Penn Medicine Lancaster General. So if you give me just a minute, I will get her slides up and then we can get rolling.
Okay. Thank you, Karen. So again, I'm Grace Meier. I'm one of the physicians at the Clinic for Special Children. And today I'm going to be talking to you about metformin therapy to facilitate weight loss in adults with classic MSUD. This is a study that I led at the clinic, and several, maybe not several, maybe just one participant is here. But this is now available online to open access. So everyone in this room is accustomed with the MSUD diet and the extreme protein restriction that comes with that. And while it's really hard to manage in infancy and childhood, I think in some ways this condition becomes more challenging in adulthood because excess calories are used as a metabolic safety blanket over time to keep patients in that building state, that anabolic state that keeps them healthy and trying to avoid catabolism or breakdown of protein. So this talk is really we're gonna kind of center ourselves in the concept of thinking about the long-term consequences of natural protein restriction over the lifetime. So here's the metabolic pathway for MSUD, which has already been reviewed multiple times today. And let's see if there's anything else I want to say. Really just that with that protein restriction and really thinking of adulthood and being able to only tolerate 7 to 10 grams of natural protein a day, this definitely does have consequences over the lifetime. So that's not even 2 chicken eggs in a day. So in 2023, I received an email from a colleague asking if I had had any experience with using metformin or any of the other diabetes medications that are now used for weight loss in adults with MSUD. And just kind of for context, the Clinic for Special Children has cared for a cohort of about 200 MSUD patients over their lifetime, not all currently with us, but still that is about our experience. And so at that point, I started looking at how many of my adults were on diet, which was approximately 20 at the time, that were over the age of 18, and about 50% met criteria for obesity with a BMI of 30 or above, and about 25% met criteria for prediabetes with an A1C of 5.7% or above. And so, although I didn't have the answer to her question at the time, that was kind of what led to us to develop this study. So we did create an open-label, single-arm, prospective pilot study. So we screened 10 of those 20 patients, and we were very fortunate to have such enthusiastic participants. Of the 10, 9 qualified. 7 qualified by BMI of 30 or higher, 1 qualified by hemoglobin A1C in that pre-diabetic range alone, and 1 qualified by both A1C and BMI. Participant 7 is not listed in this table because they failed screening, and participant 2 data is only included for the first 12 weeks because he received a liver transplant during the study. So this is the schedule of assessments, and I know this is a busy slide, but I'm just going to try to use this to explain kind of the overview of the study. So this was a 1-year study, 52 weeks. It involved a 4-week run-in period, which you can see over here, where amino acids and labs were checked, but the medication was not started yet. At week 0, we started the metformin with a goal dose of 1,000 milligrams twice daily. And we kind of slowly titrated up to that dose to try to avoid side effects and make sure that nothing dangerous happened with the amino acid levels. Amino acid levels were checked in the office 8 times over the course of the study, and then by dry blood spot weekly for the entire 52 weeks of the study. Shout out to our lab for a lot of samples there. 24-hour diet diaries were collected about 3 times in the first half of the study and then weekly in the second half of the study. The reason for that is at week 24, if levels remained pretty steady to what they had been, we decreased the calories from their 24-hour formula batch by decreasing calories from their essential formula and increasing protein from their amino acid blend to make sure that we kept their branch chain free protein equal throughout the study. So we lowered calories but kept protein the same. At that point, we started collecting diet diaries weekly, and I'll talk about the PIPE or percent intact protein equivalent that we used to try to gauge if there was any difference in leucine tolerance over the course of the study in a later slide. So here's the adverse events or the side effects. You can see this entire list because you have to be very detailed in a study, but actually very few of them are related to the drug itself. So the most common side effect related to metformin was diarrhea, which is to be expected. In typical patients without MSUD, you would still expect some diarrhea to be very common when starting metformin. I do have to say it was more severe diarrhea than I had experienced with patients without MSUD, and that's likely due to a diet mostly of formula and low-fiber foods. But this really overall was very responsive to psyllium husk fiber supplementation, which is Metamucil. And so really the patients did quite well tolerating this. Some did not have any diarrhea at all, and all but 2 chose to continue the 1,000 milligrams twice a day. I did have 2 patients that chose to stick with 500 milligrams twice daily for the course of the study, just to be able to tolerate that side effect. The only other thing to note from this table is that there was 1 case of perforated appendicitis, again, not related to metformin, but it did require an appendectomy once that appendix cooled down, and so that was about 6 weeks later, so that required a lot of sick day formula and extra calories, which is kind of contrary to weight loss. So here you can see the weights of each of the participants weekly over the course of the 52-week study. Again, it looks pretty steady. You're not seeing any major weight loss. In this figure, you can see kind of more of an aggregate view, which I think is more helpful. So the blue bars represent the change in weight from baseline at week 0 through week 24, so that point when we changed the diet. The orange bars represent the change in weight from week 24 when we changed the diet to have the calorie restriction to week 52. And then the green bars represent the change in weight from the very beginning of the study, the baseline, through the end, week 52, including that calorie reduction. And I should just also mention that all but 1 patient qualified for the calorie reduction at week 24, so that patient remained on their original recipe. Another thing I'd like to just mention is that when you look at much, much larger studies of metformin in the general population being used for weight loss, you're usually seeing about a 2% body weight loss on average. And so the average loss of the participants in the study was negative 2.8%, so it actually was more than that, and the study did not include any prescribed exercise or change in diet, as we were just trying to isolate this as the only variable. I do want to point out that participant 6 lost about 6% of their body weight. We're going to look at leucine levels, but I think that this is also a really nice marker that weight loss is possible without elevation in leucine, which is an important thing going forward in taking care of this adult population. Some other things that we looked at in the study were change in BMI over time, which you can see a slight decrease. A1C, which is that 3-month average of blood sugar marker of diabetes. You can see it's pretty steady here, and the participants that did have elevated A1Cs responded as we would expect, with a decreased A1C over the course of the study. And then triglycerides, which are the component of cholesterol that's most sensitive to metformin, did respond if they were elevated, but generally were normal throughout the course of the study. Here's the plasma leucine levels weekly as an average for the 9 participants over the course of the 52 weeks. What I do really want to point out here is that there were no metabolic crises over the course of the 52-week study while on metformin, and so that's a really nice marker of safety. This is the PIPE, or the percent total intact protein, over the course of the study as an average for the 9 patients at each of the weeks that it was measured. And so there was no change in the PIPE or in the leucine tolerance during the course of the study on metformin or with calorie reduction. In this more aggregate view, for the plasma leucine in the run-in phase, phase 1, so when taking the metformin but without the calorie reduction, and then phase 2 with the metformin and the calorie reduction for the majority of the patients, what I would like to point out is that there was a meaningful or statistical significance in the decrease in plasma leucine between the run-in and starting the metformin for those 24 weeks. And that could suggest that metformin did have some role in leucine control. However, there are a lot of other variables we could talk about, including checking levels weekly and the kind of feedback that provides patients, which is definitely positive as well. And then the other difference that I wanted to point out is that the difference between plasma leucine in phase 1 and then phase 2, where we did the calorie reduction, was also statistically significant, and that could, in theory, be the catabolic effect or breakdown effect from taking away those calories, kind of counteracting what the metformin was doing. But again, this is just kind of theorizing on what we have, the best that we can. There was no change, again, in the percent total intact protein by the numbers. By the patient's experience, there's a paragraph in the paper that talks about all of the patients that felt like their leucine was more well controlled. Again, I can't say that that's the metformin versus the checking weekly levels, but there were patients who were reporting being able to eat new, more natural protein-containing foods during the course of the study, and were very happy about that. So in conclusion, metformin was well tolerated by patients with classic MSUD. Weight loss while on metformin was modest, but did not contribute to metabolic crisis in this cohort of patients. And this result opens the door for future weight loss medications to be tried in patients with MSUD and other inborn errors of metabolism. And I'd like to thank my mentor, Kevin Strauss, the team at the Clinic for Special Children, and for all of my patients and their families for their trust and enthusiasm for this study.